Welcome, Todd. Tell us about yourself.
Very well. Thanks much for having me. My name is Todd Otten. I'm a family physician living in Michigan in the United States. And I graduated from school a little over 20 years ago and initially thought I wanted to be a trauma surgeon, but it wasn't quite for me. Fortunately, I was a flight surgeon in the United States Navy, which is a bit of a misnomer. It's more of primary care. And that obviously led to me finishing my residency in family medicine. Fast forward through being chief of staff, ACO medical director, all the normal hats that leaders tend to wear, significant burnout in 2019. Fortunately, after that, I was blessed to open a new office with three brand new nurse practitioners, and it was magical. We called it the Office Utopia. Despite the magic that we had there were some administrative decisions that were made that led to me really taking a stand, not only for myself, but taking a stand for patients and for my colleagues. So at the end of 2022, I stepped away from direct patient care, which allowed me to finish writing, editing Ripple of Change, which was published in May of this year. And since then, it's been a whirlwind of discussions and conversations, trying to inspire not just a ripple of change, but hopefully more of a tsunami in the end. So that's a little bit of my story, and hopefully that's enough.
That's wonderful. Thank you. Um, the book that you wrote a book with a patient. How unusual is that?
Absolutely. And what a magical journey. It really started with myself writing a poem called Medicine is a World of Gray, which was about 2 years after going through burnout. And it's a pretty dark poem, I would say, but part of the catharsis. And then I got really inspired and said I was going to write. And the first chapter I wrote was called Anatomy of Burnout, which kind of gives a raw, um, unfiltered look into what it's like to really struggle as a physician with all the pressures that mount on you, and how that affects not just yourself but the people around you in such a negative way. um, and one of my patients, Joshua Judy, my co-author, he was really struggling with his health. And about 2 months after I started the process of the book, I was literally running out of ideas for him on how to get him better. I knew the medicine that I had written for him devastated him. And what's ironic about that, it's the exact same drug that I still take for my post-concussive headaches that made them go away. So you talk about a completely divergent response. So I was looking for other ways to inspire him and try and get to a better place. And literally I told him about the project, and he offered back, what can I do? And I said, just write. And from there, 18 months later, we published the book that we were really excited about.
Yeah. No, I'll come back to the book in a second, but I'm actually really interested also in your burnout story and particularly that you managed to turn things around. I mean, what happens and how did you successfully get out of burnout to open this new practice?
Wow. Even just, talking about it and thinking back to those times, it evokes a lot of emotions, that raw, pain that you feel. And it's almost difficult to put into words how that all started. But frankly, I was doing too much, like many of us do. At the time, I was chief of staff, I was an ACO medical director. I was literally seeing about 6,000 visits a year, which as a family physician is a tremendous amount. But I was always trying to do more and trying to help as many people as I possibly could. And things were starting to pile up, and it was starting to adversely affect me with the flow issues in the office, the lack of respect, the lack of autonomy, the clerical burdens, the EMR. And I don't need to go through all that stuff, but it was starting to bubble up. And there was a moment where part of our citizenship or quality pay, if you will, was related to chart completion. And I had two open charts, of which I could close neither of them. My medical assistant actually had to check a box, and an administrative decision was made to withhold some of my pay as a result of that. And for me, it wasn't the money, it was the principle of the whole thing. Things just unraveled after that. I resigned pretty much every leadership position I had, of which some were compensated. So clearly it wasn't about the money. It was about the principle and doing what's right. And I think all too often in our current healthcare system, the driving factors aren't what they should be. And so that was my experience and how it evolved. And unfortunately, I was allowed to have some time off, a sabbatical, if you will, able to reset, recalibrate. Things got better, and I was well enough to come back to work, and it was good. But it still took another good 2 years after that to where I felt almost back to normal. And a lot of that was how our office went, and the magic that we had there with the kindness and the camaraderie and the laughter, what have you. And those things are often overlooked, I feel, in healthcare. Um, so yeah, the highs and the lows of being a physician, I suppose.
So that the utopia that you talked about, where did that utopia come from, and how did it develop?
Well, it started, I suppose, with me being an army of one, and then I tossed my stone into the pond, if you will, and told my office manager what the vision was for our establishment, and she was on board. And we decided that we were going to make the quadruple aim at the time, which we've since morphed to our quadruple aim, a priority in the office. And a big part of that is provider wellness. And provider, in my opinion, means everybody: the medical assistants, the nurse practitioners, the front office staff. And and the amazing part of that is when you incorporate the wellness, the other three components of our quadruple aim flow naturally. Patient experience is better, because people are happy. They want to be there. Work is a joy. The quality of care goes up, and the studies show this too, right? When providers are struggling, you're not getting their best, despite them wanting to give you that. And by allowing those three components to come into play, we were able to have discussions about cost containment and such. So really the key was we made a concerted effort to prioritize the quadruple aim, or as we say now, our quadruple aim. And that was the magic sauce. And it took some effort, it took some belief. It took me mentioning it probably thousands of times at the start. Um, but it worked, and it can be done. So it's just, I hope, and I pray that this endeavor that we've done can inspire and empower, everyone out there to play their part, to do their thing, because the power of one is incredible. And if it becomes two and you hit that S curve of adoption, things can become magical. But it has to start somewhere.
What is the quadruple aim?
The quadruple aim is patient experience, quality care, lower costs, and provider wellness. And Joshua and I, in the course of the book, decided we wanted to elevate it to connote a sense of ownership, if you will. That's why we put the hour in front of it, because we don't want it to just be my aim and Joshua's aim. We want everybody to take this and run with it. And really, if you think about it, it's akin to the quintuple aim, which brings in the social determinants of health, um, and equality and all those things. So we really tried to simplify it. So in 11 words, we came up with what we consider to be a roadmap for people to take and run with. And maybe it's just they're improving their office, but maybe they're a chief medical officer, or maybe they're in, um, a political arena where they can make a difference. And the more of us that take something like this and decide what effort we can give, or what component, we can help improve, lots of opportunity. So so again, that was a bit of a long-winded answer, I suppose, but uh, patient experience, number 1. Number 2, quality care. Number 3, lower costs. And number 4, provider wellness. That is our quadruple aim.
And you used the pond and the ripple analogy. Can you explain to me what you mean by that?
Absolutely. When you think of a lake or a pond, and it's peaceful, and you just take that one tiny pebble and toss it in there, it's a magical thing to see those ripples spread out. And we were debating what analogy to use to capture momentum, right? And so we decided to go with the water theme, in part because we feel like the ripples can not only, or excuse me, the pebble can not only create ripples, but subsequently waves, or maybe a hurricane or tsunami, depending on what part of the world you're in, I suppose, of change. And that's how we came up with that. And it frankly, it was brilliant. It was I give a lot of credit to, my co-author Joshua and his wife, because I was very much wanting to stick with, the quadruple aim component to the title, and they said, "Well, not everybody's gonna know what that is," and ultimately, we had the inspiration for the ripple of change.
Certainly, it's a title that attracted me when I saw that. Um, I guess sort of there's two things that are coming up for me in that context. So the first one would be the idea that if all of us did something like that, what would happen. But I guess also that perhaps, as you say, it might take just one pebble, the right pebble from the right person at the right time, and that might change the system. I mean, what are your thoughts on that? Sort of, is you thinking that perhaps it just needs to be one or two people that will change the system, or is this all of us that are going to change the system together?
The latter, honestly. I think it's gonna take a multitude of people. In the book, I describe an army of positive disruptors. What I've noticed in having these conversations is there are many, many good and wonderful people out there wanting to improve healthcare and healthcare delivery and the experience for patients and how providers' day goes. The issue I'm seeing is that a lot of these efforts are, and I use the word silo a lot, where they're isolated. They're only in their small community, and I feel if we can consolidate and amplify those voices, it will be very difficult to ignore if, say, thousands of people are saying the same thing. But what if we had millions of people saying the same thing in the same direction? That's going to create a lot of disruption and probably facilitate a lot of change. One of the groups that I'm working with actually is called Medicine Forward, and it's a grassroots physician organization looking to inspire and empower lots of change. And we're starting to see some traction with Gabe Charbonneau has been the leader for 4 years and one of the co-founders. We're starting to see some traction where more and more physicians are getting interested and wanting to be a part of this movement and using our voices to really make change. So to answer your question, I think we need everyone to play their part. And it might be as simple as uh, how you interact with your doctor. Joshua, my co-author, when he had to transition because I wasn't seeing patients again, he established with his new provider, and at one point during the interaction, in these 15-20 minute, racing sessions that we call an office visit, he stopped and asked the doctor how their day was, and the physician was so taken aback, they took their hands off their keyboard and looked up and said, "I've never had anybody ask me that before." And if nothing else, it probably bought him another 5 minutes of an interaction, I suppose, but the reality is a bond was created there, and I imagine they have a wonderful working relationship now, and that's just one tiny thing, right? Um, so I envision millions of us hopefully taking up our sword or whatever you want to use and making a difference.
I guess that healthcare is full of altruistic, good-natured people. So why aren't we all doing that already?
I think a lot of that has to do with part of the training, particularly for physicians. We're taught to be self-reliant. We're taught to be autonomous, individual, competent thinkers. I think that's a component of it. So I think there's some of the historical legacy training aspects that have contributed to this problem. And I feel like that's been taken advantage of by other entities, just piling on and piling on and piling on. And physicians will just work harder and work harder and work harder. And that's all well and good until it isn't. And so I think that's been a big part of it. And then you factor in some of the barriers related to electronic medical records and communication and the time crunches that exist. You know, a good percentage of physicians are doing things at home with pajama time, spending 2, 3, 4 hours charting. The last thing they want to do is add more time to their day. And unfortunately, as a result of that, things get cut off. And so, despite the altruism, people are at their capacity for work. And there's also this component of learned helplessness where they feel like they don't have any more energy to give and the system is what it is and they're just trying to survive. And I think that's a big part of what we want hope to unwind with this endeavor.
So how are you going to unwind that apathy or learned helplessness or that idea that there's no point because nothing changes. So how are you going to change that, or how can we change that?
But, one of the things that we're going to do, despite the ideas in the book that we're given, is we also are going to have a podcast, which is going to be called "The Ripple of Change: Searching for Our Quadruple Aim." And what we are going to do in the context of our podcast is to highlight and celebrate and really showcase people that are doing positive things so that, whether, like I said, whether it's at your individual level or the hospital level, you can take some of these little nuggets and make your world better. And over time, as we start to see some consolidation of this, I believe change can and will happen, because if it doesn't, this system, frankly, is probably going to implode in many places. And so that, if I had to give you one thing that I would say is the overarching theme, it's obviously what we call our quadruple aim. But I think the reality is everyone can play their part, whether it's via time, whether it's their talent, or maybe it's with their treasure, right? Maybe somebody doesn't have the capacity for some of these endeavors, but they can donate to an organization that is wanting to make change to get themselves self-sufficient or what have you. So yeah, they're not one. I wish there was a magic switch we could flip, or plug and play. But unfortunately, I think it's going to take the work of many of us.
So we all have different skills and different talents, and it doesn't really matter what we're doing as individuals. That the point is that we're doing something that contributes to us changing healthcare.
100%. And I think we're at a point where many people are afraid to speak up. For example, when I stepped away from my role as a family physician, a lot of my colleagues were cheering me on, but in kind of silence, because they didn't want to speak up against the C-suite or the executive suite pushing back on some of the things that were coming down the pipeline. I didn't have that fear, and I felt it was important that I speak up and advocate for them. And I think in the end, the right thing has happened, and we need to turn that around, where people, when something isn't right, are able to speak up, find somebody they can advocate for them, or find an ally, or feel comfortable, um, so that we're not living in this culture of fear that exists all too often.
Where did you get the strength to speak up?
Oh wow. I probably many reasons. Having gone through burnout, I had vowed I wasn't going to go through it again. And when I was told that my office was going to be moved in a very short period of time with very little notice to myself, and I went home and my wife started crying, I said, "That's it. I'm not doing this. I'm not going to go down this road again. I don't know what's going to happen next year, but we're going to be fine." That was a very powerful moment, and for me to go into the office and resign my career, after 20 years, to take a stand, that's not an insignificant thing. I went to school, for just like you, for over a decade to do what I do, and so that was a big piece of it. But the other part of it was just, I so I've known 3 of my colleagues that have committed suicide in my career, and that has to stop. We can't have the system beating people down to the point where they want to take their own life. And enough is enough. And you think about all the misdiagnoses and delays in care and deaths as a result of the dysfunctional system that we exist in. So I suppose there were several tiers to my lack of fear associated with this. And there was a piece of straw that broke the camel's back, and I'm like, you know what? Now's the time. And so I'm not going to shut up till I feel like things are getting better.
The thing that I find astonishing is that there's a shortage of us. Yeah. So in any normal market economy, we should be the ones that should be calling all the shots and be in charge. And yet somehow we've all ended up on the receiving end of something that is bad for us and is also bad for patients, as you've outlined, because the two things do go together. And I never really quite understand how we find ourselves in that position.
Well, I think I've heard this phrase frequently where people, I hear profits over people. And when there's this myopic view on the dollar sign or whatever the denomination is, it it just allows for really poor decisions to be made. And what I find fascinating about that is if we went the other way and really focused on where things should be, which is on patient experience and appropriate costs and reasonable, margins and all these other things, you would have patients for life. If a patient came into the hospital and they had a wonderful experience and were gave a reasonable bill, and had a good outcome, they would stay with you forever. But that's not what happens when the priority's on the profits, and it's just too bad. It needs to be turned around.
So I guess the priority is it's a short-term priority rather than a long-term priority, because in that model, in the long term, that would be more profitable for the business. It's just that presumably whoever's in charge today is only interested in what profit is going to be available, at the end of the financial year, or in UK where, it's perhaps not about profit, but people will be interested in this month's performance, this month's waiting times, this month's target meeting rather than what's going to happen in 10, 20 years time.
Absolutely, and I actually one of the chapters in the book is called ROI for a Health System, where that's a chapter I wrote, and I offer 10 really low cost or no cost challenges that can be they're easy to implement. For example, one is kindness and kudos. Being kind and offering, congratulations or kudos to somebody doesn't cost anything. And the return on that can be tremendous in terms of the productivity or getting a multiplying effect with your staff as opposed to a diminishing return. Um, and some of those endeavors are low cost, depending on how you perceive it. For example, a wellness officer for a health system. I make the case in the book that a cost of if you could retain one physician over the course of a 5-year period, that wellness officer's cost will have paid for itself because it costs, about half a million to $1 million, depending on the context, to recruit a physician into a system. That's a lot of money. Um, so yeah, some of these endeavors and what's the ROI for smiling and thanking people, you know, it's priceless.
Um, I'm interested in your tips for doctors. Um, I guess sort of maybe I'll start with, let's pick sort of a medical director, somebody in a very senior leadership role. What would be your top tip to that kind of person from you?
I think my top tip would be to at least take a look in the mirror and make sure that you're doing okay and make sure that your mindset's where it should be and you're not struggling with burnout. Because I think if you are, it's going to be very difficult to take some of these other initiatives and truly get the traction you want. So I would take a look, at yourself first, and perhaps some coaching is required, or cutting back on some responsibilities, that kind of thing. That's what I would suggest for a medical director. That introspective look.
What about for a clinician that's a bit downtrodden, that's a bit burnt out, that's a bit learned helplessness type? What would be your tips for somebody like that? Why how can they turn that around and be one of the ripples of change?
I think I would in that particular instance, I would encourage them to learn to say no. Learn to say no. Despite what is being told or being perceived, you are not replaceable. You are important. You are unique. You have a ton of training, and they can't just grab another one of you and put it in your spot. And so, if things are getting frustrating, you got to have the courage to say, I'm not going to do that. That's not in my best interest. It's not in the patient's best interests. And perhaps cut back on some things. Maybe it's shorten your day, maybe allow for some administrative time. But the power of no is an undervalued tool.
Yeah, I really like that. And for me, we're part of the problem because we keep saying yes. And the more that we say yes, the more as the system exists that tries to extract more and more from us, and that's not in our interest nor in patients' interest. Yeah, as you've pointed out, the tired, burnt out doctors, they're not good doctors. So yeah, so I like that. What about maybe somebody who's very early? in their career. You know, somebody who's just starting out and they're looking at these hierarchies around them, thinking, you know, what power do I have to make a difference? What would be your tips for that kind of a doctor?
Oh, that's a I think the first thing I would say is pick a field of medicine, assuming we're talking about a medical student or what have you, that you truly enjoy. Don't chase financial reward. Do something because you love it. That would be my number one tip. And then I think the other big thing is balance. Learn balance early on. Learn to care for yourself. Learn to say no. And that will pay itself over and over again in terms of return on investment.
That's great. And then my final question, maybe for anybody out there, what are your top tips for changing healthcare?
It's simple. Pick a pebble, find a pond, and throw it in. And maybe for some of you, it's not just a pebble, it's a rock or perhaps even a boulder. Um, I've probably thrown a few boulders in my time, but if we all do something, things can and hopefully will get better.
That's great. Thank you very much, Todd.